Meconium aspiration syndrome. Meconium is a mixture of epithelial cells and bile salts, dark green color, in fetal intestinal. Peristalsis is stimulated and relaxation of the anal sphincter when intrauterine stress. Aspiration may occur. MAS is defined as respiratory distress in newborn infant born through meconium-stained liquor. Asphyxia and Cronus hypoxia may predispose to PPHN. Low Apgar score. Labored breathing, respiratory distress. Nail beds and skin usually stained yellow-green. Chest, barrel-shaped or hyperinflated. Cyanosis. Low heart rate. CXR, hyperexpanded loose with atelectasis. Coarse crackles. ABG, respiratory acidosis and low PAO2. Meconium and the effects on the newborn airway. The meconium will go in from the mouth, goes down to the trachea passing the vocal cords. There is a presence of meconium above and below the vocal cords at birth. Meconium causes inflammation of the trachea. Direct suction of meconium from the throat will be performed for a non-vigorous infant. Some meconium will remain in the trachea. Endotracheal intubation will be done to give ventilation. The meconium that was left in the trachea will block the airflow, causing the ventilation ineffective. No chest rise will be observed when giving ventilation. Endotracheal suctioning is performed to suction the remaining meconium in the trachea. When giving ventilation, chest rise will be observed, airflow restored. Tracheal inflammation causes formation of mucus plugs that reobstruct the airway. Mucus plugs reaccumulate, reobstructing airflow. Prophylaxis antibiotics will be administered to the neonate. Most infants have complete recovery of pulmonary function. Affected infants have 50% of developing reactive airway disease in the first 6 months of life. Severely affected infants may have long-term neurologic deficits, e.g., CNS damage, seizures, mental retardation and cerebral palsy. Mortality and morbidity. A large retrospective analysis demonstrated the overall mortality rate for MAS to be 1.2% in the U.S. The mortality rate of MAS resulting from severe parenchymal pulmonary disease and PPHN is as high as 20%. The neurologic disabilities of the survivors are not primarily due to MAS but rather in utero pathophysiology, including chronic